Hi folks, welcome to the Pulse of St. Pete's. I'm your host, Brian Lamore. On today's show, we'll be talking about endocrinology. We have a physician in Helena that specializes in that. One of the maybe 4 or 5 in the state. Prior to his arrival here, only about 5 months ago, if you needed the services of that type of a physician, you had to travel out of town. So we're lucky to have one right here at St. Pete's. I'd like to welcome Dr. Brian Robinson. Welcome to the show. It's great to have you here.
Well, thank you very much. Thanks for having me.
Great. Well, let's start at the top. Endocrinology. That's an interesting word, interesting profession, but for our viewers, what is that?
Well, endocrinology, by definition, is the study of hormones and metabolism. Practically speaking, that means diabetes, thyroid disease, pituitary disease, adrenal glands, basically just the wellness of your glands.
And the glands, they produce chemicals for us, right? And
That's
out of those chemicals, how do we use them?
Well, again, by definition, a hormone is a chemical that is made in one part of the body, travels to another part, and causes changes. And so that's what I do. I help manipulate those into the proper working order when someone has an endocrine disorder.
Yeah, so you're part chemist, huh?
That's
basically.
True. That's right. That's exactly right.
That's part of the profession. Well, now it's interesting. You spent a number of years in Rwanda before coming here to Helena. How long did you spend there, and what all did you do in Rwanda?
Well, my family and I lived in East Africa, in Rwanda, for 5 years. We left East Texas, where I practiced originally, went to Rwanda and started a nonprofit organization originally doing community health. But after a short time, I began working for Duke University, where I taught internal medicine and endocrinology for the University of Rwanda.
Wow, that's cool. So eventually you left there, and you could almost go anywhere you wanted to, and you picked Helena. What were some of the reasons you went from Rwanda to Helena, Montana?
Well, we got used to the weather in Rwanda, and believe it or not, the weather in Rwanda is about the same every day. It's in the mid-80s. And so when we visited Helena, it was the same temperature. We thought it was a beautiful place. In addition, I had a friend who had worked in Montana in the past and said that it's a beautiful place to work, and gave us a good recommendation.
Well, that's great. Well, I hope you're not hoping mid-80s every day.
No, I hear it's going to change.
Yes, it is. Well, now let's talk more about endocrinology. As a generalization, what maybe is the major issue that you find with a lot of individuals once they come to you?
Well, like I said, my primary role has been the care of diabetic patients. Diabetes is a growing epidemic, not just in the United States, but throughout the world. And so, as our population grows, in obesity, diabetes is on the rise, and so that's what I do majority of the time, is take care of diabetics.
Now, could you maybe explain to us a little more about diabetes? I know people hear the word a lot, but they might not fully understand the process, why they're diabetic, what is going wrong in their body, and why is that happening?
Sure. To put it simply, insulin is a hormone, as we talked about. Insulin is a hormone that is necessary for us to store energy. And when our body doesn't either use that correctly, as in a type 2 diabetic, our blood sugars go high because we can't store it properly. Or if we're a type 1 diabetic, like the old term juvenile diabetic, we lack insulin, so we can't move that sugar where it belongs into proper storage, and so the blood sugars go high.
And how does being obese or overweight affect your ability to produce insulin?
Well, generally being overweight doesn't affect your ability to produce insulin. It actually alters your ability to use it correctly. So the heavier you are, the more resistant to insulin you become, and that's what causes type 2 diabetes. Okay.
And I know part of the treatment, if you have diabetes, is that you have to give yourself insulin every day, and that's done via shots, right?
That's correct.
So you learn how to give yourself the shot. I'm a needleless.
That's okay.
That has me worried. But they also have another term that is pre-diabetic that we've heard a lot. What is pre-diabetic, and why is that important to address that quickly?
Well, diabetes is defined by certain cutoffs in your blood sugars. Prediabetes is that stage in between being normal and being diabetic, and it turns out there are a lot of people who fall in that range. There are people who are obese But not just obese people. There are women who had gestational diabetes, who are only diabetic when they're pregnant. Well, those women, by definition, are at high risk for diabetes in the future, so oftentimes you call them pre-diabetic as well.
And they have to monitor that. Now, how could a person, if they're pre-diabetic, what can they do? You know, that they want to avoid the needle. What is a healthy lifestyle? Is that what we're kind of coming back to? Is a healthy lifestyle, would that help prevent diabetes? And then if you do get diabetes, how does that affect the progression of, I don't know, would you call this a disease?
Yes, absolutely. It's a disease process, and prediabetes is by definition still a disease. I think people underestimate its impact in our community. Like I said, our community is getting overweight, and so the best way to avoid becoming diabetic if you're pre-diabetic is weight loss, proper exercise. You know, we have programs at St. Pete's that are meant specifically for pre-diabetics. It's a great program. If you qualify, then you pay, I believe it's $75, and you go to St. Pete's for, you know, a number of weeks, and if you attend every meeting, they give you half that money back. And so you get an opportunity to lose weight and learn about proper dieting.
So that's so important. But now, you know, when we talk about our glandular system, I guess we can say it's so important. It affects so many things in our lives. One of the things we discussed off screen is that if children are not gaining enough weight or growth, growth improprieties are problems. How does one first determine that their child might be having a glandular issue if their growth is not proceeding as expected?
Sure. Yeah, endocrinology as a specialty also is involved in making sure that children grow and develop properly. And one of the ways that we determine that is just at routine well child checks. So it's important for parents to take their children to their pediatrician for well child checks, and if a parent or the pediatrician is concerned that their child isn't growing in height properly, or they have not started puberty on time, or even started puberty too early, that would be a red flag for the parent or the pediatrician to refer that patient on.
When you mentioned the correct height, I was wondering if somebody wanted a child to be taller than what they might expect them to be, would they talk to an endocrinologist? Can you affect height?
Well, you know, technically the answer is probably yes. Mother Nature is still in charge, and so there's only so much growth you can give a child, but I guess technically if you tried hard enough, you could make a child taller than they were normally meant to be.
Oh, that's interesting. That's really interesting. Well, now, being an endocrinologist, you know, many times when I have physicians on the show here, sometimes they say they practice their profession based on referrals from a family physician. Do you need to have a referral from a physician in order for someone to initiate contact with you?
No, I generally have a no referral policy. Oftentimes I feel like if a patient feels like they need an endocrinologist, you know, their set point for controlling their diabetes may be not the same as their primary care provider. I welcome them, you know, in my practice either way. I always like for them to come from their primary care provider because I consider myself an ancillary part of the team, with their primary care provider being their number one go-to person. And their primary care provider is always there to take care of their other non-endocrine disorders, and I think that a good relationship between the patient, myself, and that primary care provider is essential.
Okay, and now sometimes insurance might require a referral, but if you have multiple conditions, you don't manage multiple medical health problems with an individual, you refer them away, right?
That's correct. If they've got heart disease or they have asthma or something like that, I take care of the endocrine disorder that they come to me for, and then I encourage them to remain with their primary care physician because I don't do non-primary care work.
Well, now another issue that I have here that is part of the endocrine system is osteoporosis, right?
Osteoporosis.
That's problems with the bones, right?
That's correct.
It's interesting. My first thoughts, I wouldn't think that'd be part of our endocrine system.
Well, you know, as we mentioned earlier off screen, there are hundreds of hormones in our body. You know, people, when they hear the word hormone, they think of estrogen and testosterone in men and women, but there are many hormones in the body, and some of those, like vitamin D and parathyroid hormone, those affect the movement of calcium in and out of our bones. So calcium disorders, a majority of the time, fit within my specialty.
Wow, that it's all of a sudden it's a very complicated profession to be in.
It is. It is very complicated, but it's a lot of fun.
It's a lot of fun. Well, now when you're talking about vitamin D, they say, you know, when you reach a certain age, you should supplement your calcium. But in general, supplemental vitamins and dietary aids do you recommend those, or is sometimes dietary people say, you know, a regular diet is enough?
Well, it depends on what you read. You know, the Endocrine Society has guidelines for vitamin D, but then there's, you know, recommended daily allowance set up by the United States government for the vitamins required. I generally recommend that most people stay within that recommended daily allowance unless there's an indication, you know, they're pregnant or they have osteoporosis and they need more vitamin D, or unless there's a good reason, I recommend most people just stick with the recommended daily allowance.
As a supplemental, right? Okay, because there's so many supplementals out there. You go to a real food store or something, and it's like their shelves are full of specific vitamins.
That's
and it must be, if individuals start, I don't know, self-diagnosing and start taking specific vitamins and hormones, or not hormones, but you know what I mean?
Well, hormones, yeah.
Yeah, hormones. It seems like that could really throw a system off. With everything that we have, it looks like there's a delicate balance. And is there a standard balance for everybody?
You know, I mean, I'm a minimalist, I guess. I think that there is a standard balance, and people should eat well and take care of themselves. Taking excessive amounts of vitamins can result in problems. There are some vitamins that are not easily excreted from the body when you ingest them and can cause side effects, like too much vitamin D. If you overdose on vitamin D, your calcium in your blood can go very high and cause problems. The other side is there are vitamins that are, when taken by mouth, are immediately excreted in your urine, and so basically you're just creating expensive urine at that point. So.
Yeah. Well, I noticed another point here is that it's cholesterol disorders, and they talk a lot anymore that you need to know your cholesterol numbers, but they would come to you to help maybe take it to a next level up in working with cholesterol, right?
Yeah, that's a tough area. There's the basic cholesterol panel that most people get. You know, if you're diabetic or if you're a man who's got heart disease, there are new standards for the control of your cholesterol, but there are also genetic disorders which cause cholesterol to be 10 or 20 or 100 times the normal range. Those are oftentimes the patients that I would normally see. And so it's something more than just your basic everyday cholesterol.
So when they get way off like that, imagine is a primary physician involved with it, and they're saying it's time to get an expert in the field, and that's when they'd call you.
That's correct.
Right. Okay. Well, we also were talking about infertility. I mean, it's like, boy, all these topics are all over the board.
That's exactly right.
How do you help with infertility?
Well, infertility can be the fault of either side. You know, in our society, and especially in Africa, where I was before, infertility was almost always assumed to be the woman's fault. But in reality, statistically, 30% of infertility is caused by an abnormality in the woman. 30% of infertility is caused by an abnormality in the man, and 30% by both simultaneous. And probably a majority of those are due to some form of hormone deficiency or abnormality.
Oh, wow. And then is it many times addressable through, I guess, how do you address a lot of these issues? Do you then give them pills, vitamins, hormones, over the counter? How do you address them?
Well, I mean, every good interaction with a patient starts with a good history, asking lots of questions, just like you are. And then once the cause of the infertility or whatever the disorder is determined, then, it's usually some form of manipulation of that hormone, either by giving it or by giving something to counteract an excessive amount of hormone that the patient may have, or
So when we talk about what's providing or creating these hormones, it's a gland, and the gland can be working too well or not at all.
That's correct.
So how do you complement or address that issue to bring them back to normal? That's interesting.
Yeah, that's a complicated question. There are many many modalities. There are many medicines and other hormones, synthetic hormones, that we can use to manipulate other people's hormones up or down based on, whatever we feel like the need is.
Yeah. Well, we're talking about the physical effect of hormones, but I imagine there's also, I'll say, a mental or emotional aspect of that too. And when we work with individuals that are working with the emotional and mental issues, they can probably access your expertise too, I imagine.
Yeah, I mean, there are plenty of endocrine disorders that cause, emotional problems like hypothyroid, thyroid disease, or even menopause. Or for men who have had testicular cancer who no longer make adequate amounts of testosterone. Those are patients who can certainly have, depression or anxiety or some other psychological manifestation of endocrine disease.
Well, you mentioned testosterone, and you can see on TV you can buy buy the pill.
Yeah.
Yeah. And there's a lot of people that I imagine they're saying, well, I'm going to buy this pill, and I'm going to, I want to say, self-diagnose or self-manipulate their balances. Is that recommended? I mean, can a person really take a little bit of time and adequately study well enough to initiate changes in their own body with understanding the full effects?
That's a loaded question.
I'm good at that.
That's right. I don't want to, downplay anybody's own personal ability to self-diagnose. We all do it. Even me, I'm guilty of that, and maybe I've even made the wrong diagnosis of myself before. But we can get ourselves in trouble by taking over-the-counter hormones. Those are supposed to be well regulated by the United States government, but they do still come in from other countries, and they're even produced by under the labels of natural or organic, and are oftentimes given inappropriately to patients. And so, yeah, the ingestion of natural or organic animal hormones can actually be very problematic sometimes for people.
Yeah, they can cascade and cause problems downrange. We're talking off screen, and I was mentioning at one time, I was talking to another individual, and they said basically our body's a chemical producing factory.
That's right.
And it's all dependent upon what we put in it. You put in good chemicals in, you get good results out.
That's exactly right. That's exactly right. You've got to be very careful, and if you have a question, if you're finding things on the internet, you're finding information that either you don't understand or that you aren't sure about, come by and see us.
That's great. Well, now, Brian, we're drawing to a close on the show. What are some of the final thoughts you'd like our viewers to remember about an endocrinologist?
Well, again, basically an endocrinologist is just someone who cares about your diabetes. I mean, that's how people normally see me. More than half of what I do is diabetes, and I believe that our community is growing obese, and I think that's going to hurt our community and our families in a big way. And so I just want to encourage people to eat right, exercise, and if not, then I'm available.
You're available. And also through St. Pete's, they have programs to help you control it, address it, be informed of it, how to monitor it, and hope no offense, we don't get to the point that an endocrinologist has to assist you.
That's exactly right.
Great.
That's right.
Well, Brian, thank you so much for being on the show, and welcome to Montana and Helena. It's great to have you here.
That. Thank you very much.
Okay. And for our viewers, again, we have an endocrinologist, one of about 3 or 4 in the state. If you needed the services of one of them, you had to travel outside Helena. And now, for the last about 4 or 5 months, Brian has been here. If you'd like to contact him, you can just call up St. Pete's, ask for Dr. Brian Robinson. If you'd like your physician to refer you, talk to your physician. He can be the right person, the right profession to address a number of issues that you might have. For the Pulse of St. Pete's, I'm Brian Lamore. Thank you for joining us.